Let me now show you how to reduce chronic neck and shoulder pain. First thing first, palpate through your anterior muscles. They're called the scalenes. Are you finding a point that is hypersensitive, maybe even knotted up? Palpate through the region of your back muscles, the trapezial muscles, into the rotator cuff. Are there knotted up, hypersensitive knots or focal points of tenderness? This indicates a myofascial point. Here's the problem. If they keep coming back on you, you've had massage therapy, you've taken anti-inflammatories, you put muscle rub into it, you might have even had a cortisone shot, but it just keeps coming back. This indicates it's not a peripheral problem or a muscular problem. It's actually a central nervous system processing problem. Let me show you how to fix those nasty bugs in your central nervous system that are constantly causing the problem to occur. When you turn your head to the left, the muscles of your neck and shoulder should be relaxing. But if you've had an injury where your brain has reset those muscles, instead of relaxing, they're contracting and tightening, what happens? They begin to cause micro tears, knotted up musculature, inflammation, chronic pain. Your C-reactive protein levels go through the roof. That is not a good thing. Chronic inflammation is linked to dementia, is linked to cancer, is linked to heart disease, and obviously, it's not a fun life. So let's fix those chronic central nervous system processes. Here's how we're going to do it. We need a couple things. One, consume your Generation 10 PM brain and pain formula. 3 reasons. 1, we need the inflammation rates low. 2, we need advanced tissue regeneration. 3, that formula was created to penetrate your blood-brain barrier naturally. There are no drugs in that formula. It goes into the quadrants of the brain that are on fire, hotspots we call them. Those areas are not functioning correctly. In fact, when the muscle is relaxed, it's contracted. It's tight, even when you're sleeping. You can't reach REM sleep when you have these hotspots. Consume your modified Generation 10 PM Blend Pain and Brain Formula. It is embedded in the blog. The recipe that you'll need is in this blog that you're watching right now. Number 2, you need a visual anchor. Find yourself in front of a mirror. Place a visual anchor. In my case, I'm going to write or draw a cross. The visual anchor is what we're going to use to modify the central nervous system. My issue is right trapezial, right scalene, and right rotator cuff issue. So what I'm going to do is I'm going to anchor my eyes to the cross. Crucial, critical for you to address the central nervous system process and work on that vigorously. Number 2, you need to anchor your right arm. The right arm must be anchored when you're dealing with a right trapezial issue. You can anchor your right arm many different ways. You can take the right arm behind your back, pull down on it, anchoring it with your left arm, and this is your second anchor. Or a 10 to 12 pound weight. In my case, I'm going to be using a 20 pound weight. 10 to 12 will work just as well. And what you'll do is you'll secure that in your hand. You're going to take your shoulder back and down. So I want that shoulder to move back and also inferior. I'm going to focus my attention on the cross. My eyes are focused, and I am going to turn away from the trigger point. So if it's a right trigger point, I'm turning my head to the left, and I'm going to focus on the cross, turn. I keep my eyes on the cross at all times, even as my head is turned vigorously to the left. I'm not only turning my head to the left, but I'm also looking over my left shoulder. And what that's going to do with my ocular anchor and my shoulder anchor, I'm going to begin to train my brain to tell that muscle, instead of contracting, we want it to relax and become invigorated, but not in a contracted, inflamed state. I'm going to repeat this over and over again for 15 repetitions. I will need to do this exercise a minimum of 3 to 5 times a day until I've broken that chronic myofascial pattern that was developed from an old injury. One more time, you need an ocular anchor. Crucial, do not do this exercise without one. Number 2, you need a shoulder anchor. You need to anchor the shoulder and the arm on the side that you're working on. Number 3, you're going to turn your head, but you're also going to make sure you always keep your eyes on that cross, on that ocular anchor. Use your PM blend formula before you go to bed. This is an exercise you need to do 3 to 5 times a day until that nasty trigger point is gone. Good luck and enjoy.